I wish I knew this when I started practicing dentistry. So, in the first year after you get out of dental school, what are some things that you can do to make your life a little bit smoother? Okay. The first thing that I really encourage people to do is to find a mentor. Okay. If you can find someone who is a little bit older, like me, and they're willing to talk to you, like me, I would be happy to discuss things with you. And the reason is that there is what we learn in dental school, right? And it's by the book, right? That's what we learn in dental school. And then when we get out and we're in the industry, we're faced with a lot of other variables that we didn't have time to discuss in dental school. And you're like, whoa, we didn't even talk about this in dental school. Many of them can be related to just running the business of dentistry, right? Which we don't get hardly any feedback on, right? We get no education in dentistry, how to run the business, how much time did we spend in dental school learning how to communicate with patients? Just how do I even tell them you have a sick tooth, because you have to develop a set of skills over time in order to be able to communicate with people in an effective manner. And so that takes time and experience. And if you can find someone who is a little more seasoned, that's a polite way of saying it, then they can help you. They can point you in the right direction. They can say, oh, you know what? There's a couple of really good books. I would really encourage you to read this one and this one. And they really point you in the right direction. For instance, I stumbled onto some books on nonverbal communication. Super powerful for dentistry. Super powerful. So you've got the verbal word, where the patient's telling you something, and then your mind is thinking at the same time about their nonverbals, about what they're really telling you. And so that is really powerful for a clinician to have that ability to see the verbal communication and the nonverbal, so you can really try to assess exactly what's going on in the situation so you can help your patients. So the first thing is that, find a mentor. The second thing I would say is get in a group, okay? Start it with your friends from college. So the ones you went to school with that you liked, get in a group with them. And now it's easier than ever, right? You can just use WhatsApp to be in a group, and you can say, hey guys, I had this case today. Look at this radiograph. Can you give me some feedback, right? And by having the collective together, it really, really helps things because everybody remembers things slightly different. And so your friend says, well, yeah, that is true what you said about that. But remember, there's this one time when it could be like this. And that points you in a different direction. And it really, really is helpful. Plus, it's kind of fun because you guys are in it together, right? You're kind of going through it together. If in that group, you can mix in some seasoned people, that's even better, okay? And how do you do that? Well, the easiest way to do that is to join an organization. So you can join the AAID, you can join the ICOI, you can join AO, all of these organizations that are designed to help continue your education. In those in particular are related to dental implants. But even if we're talking even outside of dental implants, you might go, I'm interested in aesthetics, then you would check the AACD for American Academy of Cosmetic Dentistry. So there's organizations for everything, right? So you join one of those organizations and you'll meet great people there. You can find your mentors there. You can get into groups, and we'll call them a mastermind group. And so that's a great way to go. It's also got great education, and they usually have good journals that go along with them. Now, there's one thing that I will tell you to hold back on. Okay, so these are things I'm telling you to do. Here's something I will tell you not to do. Don't do it all. Okay? Don't do it all. You went to dental school because you're smart. Okay? You went to dental school because you're driven. That's why you did it. Okay? You want to help people. You're a driven individual. You wouldn't have done all that work. You wouldn't have gotten in. You wouldn't have done all that work if you weren't that person. Okay? So you want to know it all now. It's too much. So bite off manageable size things one at a time. So you might say, okay, I really want to get good at periodontics. I need to get good at perio. That's the first thing I really want to get better at. I want to know more about perio in my office. And so then what you do is you go to the world's best perio course. You find out when it's being happened. Say, for instance, it's Pat Allen down in Texas, okay? And you go to his course. and you learn about it, and then you come back and you start to implement the techniques and the knowledge that you learned there. And then about 6 months into that, you start to feel comfortable with that. You say, okay, now I feel good about that. Now there's something else I want to take on. I want to learn about oral surgery. I want to learn about how to take out teeth more effectively because I didn't feel like I got a good amount of that in school. Then go to a course on that. Okay, so then you get educated on that. But don't do it all at the same time, okay? Because you're driven to do that. We are all driven to do that, but your head will implode. Remember, you've got a life. Most likely you're married, and most likely you either have a couple of children or you're about to have a couple of children. You need to balance these things, okay? And you're on it's like a marathon, right? It's not a sprint. You've got to think to yourself, I've got many, many years to become the master dentist, or what they call now a super GP, which is just really a GP that has taken the time to go out and educate themselves in the areas that we're already trained in to the next level, okay? Just pace yourself. Don't go sprinting out the door and then burn out in the second year and implode, right? So give your family some love. Give your wife, your husband some love, your kids some love, your dog. Go out, walk in the woods, have a life, okay? But break off things one at a time, one subject at a time until you get to whatever that time frame is. For me, typically, whenever I took on a new topic, it typically took me about 6 months before I got to the point where I didn't need to think about the case anymore. If I had, let's say, an aesthetic crown lengthening case coming up the next morning, I didn't need to think about it. I just said, okay, I got a case in the morning, and I just went in and did it. Versus what you do when you first start is, okay, let me go back to the rules. Let me open up the notebook. How far? Where's the reflection? When can I make an incision, a gingivectomy versus not? How high apical do I have to reflect the tissue? All the details that go in. What kind of suture was I going to use on this case again? What was recommended? All of those details. When they become second nature to you, that's when you've mastered that technique and that surgery. Then you can move on to something else. So in general, take it easy. Break off small things. Get into groups, find friends, and find mentors to help you, and your dental career will be amazing. Best of luck to you. This has been another episode of Implants Made Simple. I'm Dr. Robert Stanley. Follow for more.